What is bio-PRP or bio-GFC? Another question. PRP we have growth factor concentrate, whereas in bio-PRP we have growth factor concentrate plus 53 types of micronutrients. That is called bio-PRP. How is the PRP procedure done? That's another question. Procedure is very simple. It goes under local anesthesia. We need to take 8 to 9 ml of venous blood from the patient. That is going to put into the centrifugation tube. That is called PRP tube. We send it for centrifugation. Centrifugation is a process where we're going to spin the tube in high speed. Our idea of spinning the tube or centrifugation process is these platelets supposed to subject to trauma, then only the growth factors will come out. That's what we're going to do in the centrifugation process. Once we do the centrifugation process, we're going to get this plasma, platelet-rich plasma, upper layer. Below we get this RBC and WBC get settled. Those things will be discarded. So platelet-rich plasma, we're going to take it and inject into the scalp. All this procedure goes around 10 to 15 minutes.
Hi, this is Dr. Vinod. So now I am giving PRP. First I'll give anesthesia front side. Then I'll give PRP from front to back everywhere. I'll spread everywhere from here to here everywhere.
What are the precautions before and after the PRP procedure is another important question. Before prior to the procedure, one should always have some breakfast and come, and one should not have alcohol at least 6 to 8 hours prior to the procedure. And that's the only precaution prior to the PRP. And after the PRP, there is no precautions. They can get back to the work or workouts or even any work. So there is no any precautions after the PRP injection done. Who can take bio-PRP is another interesting question. Patients with generalized hair fall, patients with stress related hair fall, patients with family history of baldness, who's undergoing baldness process, patients with post pregnancy, post COVID illness, post any fever, anything, post medication. So these are the few indications where we can use the PRP for the hair. There are other purposes also for skin, but we are discussing about hair purpose here. So any generalized hair fall, telogen effluvium hair fall, and multivitamin deficiency hair fall, all these are the indications for bio-PRP injections. And whoever undergoing the thinning process, thinning hair, that is called miniaturization, that's a balding process, youngsters, we can take it. Are there any side effects with bio-PRP is another interesting question. Usually this PRP done from the patient's own blood. This is absolutely a safe procedure, goes under local anesthesia. I don't think there must be any side effects with the PRP. After the PRP they can get back to work immediately. How many sessions one should consider? Usually this hair cycle will be around 4 to 6 months. So one always should consider at least taking 5 to 6 PRPs to enhance or to see better improvements with the PRP sessions. Are there any medicines or multivitamin therapy along with PRP is recommended? Is another question. Yes, few multivitamins always gives you a best PRP, and that goes adjuvant with bio-PRP, always get you better outcome. So multivitamins are recommended along with bio-PRP. It's always better to take few multivitamins, and PRP always to get you reasonably good outcome. Are there any pre-blood test required to undergo PRP is another question. Usually no blood tests are required to take bio-PRP injections. However, when we talk about blood test, it's better to speak to your doctor, and probably sometime blood tests are recommended to know is there any multivitamin deficiency. That will be done, maybe that can be done after first or second session of PRP also. Can I use helmet? Can I travel? Can I go to gym or workouts after the PRP? That's another question. If you guys have it, usually no such restrictions. Immediately after PRP, you can go to workouts, you can go to work, you can use a helmet, you can ride the bike, no problem with that. Few guys will ask me, can I apply hair oil after the PRP? Yes, no issues with the application of the hair oil and no issue with the washing immediately. Even after the PRP, you can immediately wash it, no problem. How do we inject this PRP to the patient's scalp? Of course, it goes under local anesthesia, and they'll ask me, is it painful? It's not at all painful. You have a very small pinch of pain while giving anesthesia once or twice. After that, the frontal area wherever we are going to inject the PRP, that will become numb. I think it's painless procedure. One can happily take it and get back to their work. How much time will it take to undergo one PRP session? It takes 10 to 15 minutes. Does it leave any marks or remnants on the scalp immediately after PRP? Is another question. It doesn't leave any marks. No one will understand that you have done a PRP. Immediately after the procedure, you can get back to your work. Few guys was asking me, is there any relation between local anesthesia and efficacy of bio-PRP? There is no such relation between local anesthesia and the bio-PRP efficacy. A little more details about PRP is, a few guys are asking me how many injections you are giving during the PRP and where to inject. So how many injections means we take a very finest needle available in the market, that's a 40 gauge, and we'll distribute all over the affected area, front, mid, scalp, even in the crown area. Usually backside, which is not necessary. So wherever the bald area or thinning area, hair fall area, we can inject it. However, wherever you inject in the scalp, it will absorb throughout the scalp uniformly. So it doesn't matter basically. So how many injections means little quantity we'll be giving everywhere, and there is no count on injections. We'll give everywhere wherever the affected area with the little quantity. Our idea is to spread and inject it homogeneously everywhere. Is it required to shave hair before going to this bio-PRP? Actually, it is not required to shave any hair to do the bio-PRP. At times, we may not recommend bio-PRP for all the patients. Someone has some medical issues. I'm not going into details right now here. Kindly bring to your doctor's notice if you are suffering from any medical illness like a heart problem, liver problem, kidney problem. So that can be discussed during the consultation.